Hey, welcome back to Teaching Tuesday. This is a pretty cool topic about why sometimes do we break people's bones in rhinoplasties and why don't we sometimes? Well, here's why. If you have a patient like this one or this one who has this hump, right, and we're trying to make that smaller, right, to end up here or there, you can tell this is bone and this is cartilage, but either way, we need to reduce that. Now, especially in the upper part where there's bone, if you look at it sort of from the bottom up, what you would see is that there's the septum, the part in the middle that separates the two sides, and these nasal bones on the side. Well, here's a patient, this is the cartilage part of the hump, and this is the bone part. If you, let's just say, cut that off so it's not a hump and it's flat, once you cut into the bone, cut the top off the bone, it's like taking the top off of that teepee, see? And when that's removed, you see there's a space in between this bone, and the septum. See that space in there? And that can sometimes even be so wide that you can see the three pieces and a groove in between. Either way, even if you couldn't see that, here it comes to a nice tip and a nice point, a narrow dorsum. And here, once you take the tip off the teepee, it's much wider. And you don't want to take it down, but then have a wider nose in that area. So what we do is we start here, take the top off, then we have to take these walls and break them along the bottom and push the walls back in until you end up with a narrow top of the nose like you had to start with. So if you take this down and it leaves it wide at the top, or you can see these openings, then you have to go along at the base, break those bones and push them back together to make it narrow again. Hopefully that makes sense. Pretty cool thing about rhinoplasties. Next time, I want to talk about the tip, what we do in the tip, and why sometimes when we work on the tip, we don't need to touch the bones at all. So see you then.